we now move on to the finale, the plan. This can be considered as an extension of the treatment, or you can consider it as a summary of the whole perfect consultation process. Now, when the patient first came into you, there's three things they want to know. Can you help me? What's wrong with me? And how long is it going to take to get over this particular problem? Hopefully by now you've diagnosed and educated the patient enough so they know what's wrong with them. And by treating them, by educating them, by explaining all the things we've previously spoken about, they have won your trust and now they understand, yes, physiotherapy can help this particular problem. The final question is also just as important. How long is it going to take to get over this particular problem? This is not a very easy question to answer because every patient is going to heal and improve at a different rate. What we can do, however, is give patients a bit of a ballpark summary of how long it might take to get over this particular problem. So if it's an acute injury or if the injury is fairly new, it can take anywhere between 2 to 4 sessions over a period of up to 2 weeks to get over it. If the injury was a little bit moderate, it's been going on for a couple of months, it can take anywhere between 4 to 10 sessions. And finally, if it's a long-term back issue or they've had this injury a long time ago, a few months ago, many years ago, it can take anywhere from more than 10 to 12 sessions over a period of 6 weeks to up to 3 months. These are very general figures. We have to remind patients that after every few sessions, we reassess the problem and see what progress you've made. So initially it might be that the patient needs to come and see you twice a week for the first 2 or 3 weeks, after which we might reassess and drop it down to once a week, once a fortnight. It all depends person to person and what injury they've had and what age group they fall under as well. It's a very complex question to answer. So this is the end of the perfect consultation. I hope you've learned something out of this and you can apply it to your practice as well. If you've got any questions, feel free to reach out.